Hey everybody, it's Jessica DeMassa with What's the Future of Health? Thanks for joining us as we talk to the who's who of health tech and healthcare innovation. Joining me today, we have the CEO and co-founder of Buoy Health, Andrew Lay. Andrew, it's a pleasure to have you with us here today.
Thanks so much, Jessica. It's great to be here.
All right, so a lot of chat about Buoy, and like not just because your last funding round, your Series C, which was 37.5 million that you closed in November, had not one, not two, but three health insurance companies in it. Beyond that, I think people have been talking a lot about your model, symptom checker to start out with, but slowly evolving. So why don't you jump off there for us and give us an update on what's going on at Buoy Health, specifically what has made you so lovable to insurance companies as of late?
Well, I appreciate you saying that. Calling us lovable, is always good to hear. When it comes to why payers care about what we're up to, the core challenge that we're solving for their members, for people generally, is that when you get sick, you suddenly have to become both kind of like clinically trained like a doctor, and then you also on top of that have to become an insurance expert all of a sudden. So, when you think about the last time, you had a symptom, Jessica, you'd first have to figure out, okay, this is my knee pain and clinically I should go see a physical therapist. That's hard to do. On top of that, though, to then say, the physical therapist down the street is out of network, but the one 2 blocks away is in network, is also really challenging. And so what ends up happening for people is that they Google it, they read something online, and then they just shotgun into care. And so when you think about it from a payer perspective, they've done all of this work curating all these different networks, right? They've contracted with different physical therapists, different doctors, hospitals, virtual solutions, point solutions to give you a set of services that are aimed to get you better. But the issue here is that you really can't figure out what component of what service within your network is the one that's clinically most relevant to you. And so that level of uncertainty kind of initially is just a really big struggle. So we created a product that uses an AI chatbot to talk to you and fill both of those knowledge gaps. It helps you figure out first clinically what's most likely going on, kind of empowering you to make a decision as if you were clinically trained. And then if we match it to the payer's network or to the self-insured employer's network, we can say, okay, now that we know the clinical situation, right, which is again the most important, and then we know the time of day, we know your location, and then we know your network design, we can point to you, okay, that physical therapist 2 blocks away is the one you should be going to. And when that happens, the net effect is a better patient outcome at a lower price and a really good experience for this person who, again, otherwise would be scared, confused, alone, and left to the travails of like searching online.
Okay, let's unpack that because what you just said there is so remarkable to me because not only is it like, let's figure out what the right care is for you first, but also then figure out what's going to get paid for by your insurance company or by your employer. So the thing there, like you make it sound so simple, like, oh yeah, and it's magic. And I think like one of the things that has happened with you guys is that you've been labeled, I think in the market as symptom checker, but no, so much more than symptom checker, care navigator, intelligent care navigator. And now on top of that, figuring out too what the right pathway is that not only gets the right care, but also the right payment of care. So explain to me, I guess, like bigger picture wise, like zoom out of your example there about the knee and talk about how your model has evolved over the years to do this. Because like this is like the complexity of like, I don't know, I think of something that's so much more frictionless to operate, like Uber. Like, there are multiple systems at play there. It's like it knows your location, it knows where you want to go, it knows, what's around you. So, I mean, talk to me, I guess, about how your business model has evolved, because you make it sound so simple with like, oh yeah, it's just like technology. And it's like, it seems like it's so much more than that. Paint us a full picture of what's going on under the hood at Buoy Health.
Sure. Yeah. So zooming out a little bit, Jessica, just as you suggested, when we think about the Buoy story and we think about our hero of the story as the person, who's sick and is alone, as I mentioned, potentially very confused. And, we're the guide, helping them along their journey. When we think about the villain, we really think about the villain in our story as uncertainty. There's this massive amount of uncertainty. And when we look at what people have attempted in the past to fill that uncertainty, it's largely been around things like price transparency, right? So if I show you the price of urgent care versus an emergency room versus going to your primary care doctor or different MRIs, maybe you'll shop and you'll say like, yeah, I'll pick like the cheapest one based on the price, right? Or quality transparency is another like thing that people have tried. If I showed you this doctor has this grade and this doctor has this grade, ideally you would choose the better graded doctor, right? Our whole thesis is that the first level of uncertainty, the one that's almost like foundational, it's like the foundation of the home, is really clinically what's most likely going on first. And so in many ways, and there's a lot of like great studies about this. As an example, they went around an emergency room and they asked people, why are you in the emergency room? And they gave people a bunch of options. Was it the access because it's convenient? A lot of people think, people go to the emergency room because it's really convenient. Was it because of a price thing? Was it because of a quality thing? Or was it because of how sick you think you are?
Yeah.
Lowest on the totem pole was price. Was quality. Second lowest was price at 6% of people. And when you hear that, it kind of makes sense, right? So like, if my dad were sick and something was going on, my first thought in my head is not how much is it going to cost?
Cost me, right?
Right. That would be like Scrooge McDuck, right? And then surprisingly, only 22% of the time did people point to access, which I think people think of the emergency room, they immediately think, oh, it's easy access. So that's why people are running in. Right. And actually 66% of the time, it was because people thought it was clinically the most relevant thing for them to do.
Yeah. I don't know where else to go. So I'm just going to go here.
It's like, I think I'm sick enough to go to the emergency room. So I'm going to go to that emergency room. So when we think about what we're doing and this fill-in being uncertainty, if you don't solve the clinical uncertainty first, everything else doesn't matter. And so that's why we started the company first with figuring out symptomatically what's clinically most likely going on, because that is the basis on which navigation can occur. So, when we started out, it took us 4 years to build Buoy from scratch based off of thousands of clinical papers. I can talk to you a lot more about how our AI was trained and how it evolved.
Yeah, say something about that, because and maybe in the context of like how accurate is it now after all of that training? Like how accurate are you? Can you talk about that at all?
Sure. So the way that we initially built the program was we read by hand thousands of pieces of clinical literature. I compare it to it's like you had a medical student who read all these papers and memorized all the stats and was able to use these statistics to interview patients. And every time they would answer a question, we could re-rank all the possible questions and re-rank all the possible diagnoses and then ask the most relevant next question. We launched that product in March of 2017. We did an initial study in an urgent care where we're looking at patients who were using Buoy in the waiting room before they saw the clinician. And then we compared what the clinician said with what Buoy said, and we overlapped with what the doctor said about 90% of the time.
Wow.
And then we launched it directly to consumers and started seeing people use it in real life, because how you use it on the internet is very different than how you might describe it to a doctor once you've decided to see a doctor. And so the use cases are very specific to like where we sit in the healthcare journey. And I can talk a lot more about that. But after, I think today we've had, over 10 million people come on Buoy, use the product, tell us what they were diagnosed with, tell us where they ended up going. That's allowed us to create machine learning algorithms that basically get better on their own. So today, when we look at our correctness rate, which really is after they've seen what's going on, they tell us whether they had seen a doctor, what the diagnosis was. We agree with that doctor's diagnosis about 77% of the time. Now you'd ask, why was it like in the beginning 90, but now it's 77? The difference there in our view is that when you go see the urgent care, you've already self-selected. And so it's a much smaller set of use cases that you're seeing in urgent care. That's a little bit easier from a universal perspective versus when you're using Buoy, it's very early in the healthcare journey and it includes all kinds of stuff. So there's a very long tail of all these situations that people are coming in with. So it's much broader. It's a much bigger problem. Which is why we see that kind of discrepancy. But our strategy is get as many people as possible to use it. Tell us what happened, and then we are slowly but surely going to get better. And we really feel that at some point we're going to hit this acceleration of our improvement as we hit a critical mass of number of users.
I can totally see that because, of course, to prep for this interview, I went on your website and I was like, I'm going to be a jerk and just do this symptom checker in like a nasty way without like giving a lot of information. And it actually, I pretended to have a tummy ache. And then it ended up, asking me a series of questions to try to, select things out of it. And then it ended up, and this is the interesting part, Andrew, that I want to really dive into here, and not from a care journey pathway or anything, but from a business model standpoint. So I get to the end of this with my tummy ache. And it gave me two options of what to do next. It gave me an option to see a doctor via Doctor on Demand, or to sign up for Headspace, because it must think that maybe my upset tummy is due to some sort of maybe anxiety or something connected to my mental health. So tell me about how this happened, because I was very, very surprised to see that I ended up being referred to those two companies. Are you guys working with, what is the relationship there? How does this tie into your business model?
So our core business model, just to talk about that first, and then dive right into your question, Jessica, our core business model is we sell an enterprise version of Buoy to self-insured employers and payers. And they get to do two core things with that. One, they get to customize our endpoints that you saw to their specific network design.
Right.
So individual employer, individual payer, it'd be like they're in-network doctors, they're in-network point solutions, their employee assistance program, their benefits.
Yep.
In addition to that, we get to they get to customize Buoy to be onto their portal. So an employer might have an intranet, an HR benefits platform, and payers would have their own portal, and we would sit on the portal. And so we're a tool that sits on top of their products.
And that's awesome, because that's where you get the opportunity to not only recommend based on care, but also recommend based on care plus what's in network, right?
Exactly.
Okay, keep going.
I guess the challenging part of that model, though, is that a lot of times people aren't turning to their employer or to their payer for advice when they're sick. And so our view of it as well, we started the company, and I can tell you more about kind of the backstory of how we started Buoy, but we started the company because we were seeing how many people were Googling their symptoms before they were running to the doctor, right? And so we wanted to go find people ourselves. And we're having millions of people now coming directly to buoy.com. And when they come to our site and we help them figure out clinically what's going on, towards the end of the interview, I don't know if you noticed this, but we ask you whether you get insurance through a payer, through your employer or through a payer. And if you said yes, we then ask you who's your employer, who's your payer. And if they happen to be a member or an employee of one of our clients, then obviously we would show them the in-network options that we would have done had they gone to the portal, right? So it's additional engagement to the services that would have happened had they gone correctly to the portal.
Which is awesome, because it's routing them back to where they technically should have gone, but didn't even realize that they needed to start there. So good.
Exactly. However, if they are not a member or an employee of a client of ours, we don't know their benefit design. In which case, we can now show them options in our own marketplace that they could potentially pay for out of pocket. And in our prep call, we're talking about amazing companies like Roe and Hims. We're seeing that with people moving on to high deductible plans, or unfortunately losing their insurance because now they've been furloughed or let go. In the economy that we're in, a lot of people are having to pay quite a bit of their healthcare out of pocket. I think there's a study I saw recently that said that the number one payer of healthcare in aggregate in 2021 is going to be the individual.
I believe that.
Which makes sense.
Mm-hmm.
And so in that situation, we could show people services that they could purchase that can help them on their path towards getting better. That would be out of pocket. So it's really creating this marketplace of services that could be customized to your benefit design, or could be a cash pay option, and hybridizing that world depending on who you are, what we understand about you, what we understand about your benefit or insurance design is what happened in your situation.
All right, so say more about this, about from your perspective, I mean, as the CEO of this company, what is the utility of that, of developing this marketplace approach? I mean, because when we started chatting, it was like this has gotten now so far, but I mean, logical steps forward, but this has gotten so far from where you guys started out in terms of symptom checking. I mean, and going beyond that now into navigation, and now into like building this aggregation of curated options, either based on somebody's health plan or based on what you guys are able to build and provide direct to consumer. Paint the picture for me moving forward. I mean, what is next for you as far as this marketplace approach? And like, tell me, I guess, where your thinking is as you look strategically at what's next for scaling up in the business. I mean, you guys have raised a total of $68.2 million. I mean, scaling up is still important, and I'm sure there's more money to be had there as you grow. How do you see this marketplace approach really meeting the needs of not only payers and providers, but also, I mean, of course, of people, like you said, the person that at the center of all of this is they're looking for care moving forward. How is this the way of the future in your mind?
Tying together this idea of the marketplace to this, like where we started, which was this symptom checker, right? Our core belief, going back to this idea of uncertainty, but specifically clinical uncertainty being kind of the villain of our story that we're trying to overcome. We really see that marketplaces in healthcare have never addressed the issue where the demand side of the marketplace, the patient, at the end of the day, doesn't really understand what part of supply they should be purchasing. It's not like Amazon. You go on Amazon, you want to buy a t-shirt. I know I want a t-shirt. I know how much I'm willing to pay for it.
Mm-hmm.
I'm going to buy it, right? I think healthcare is a lot more like going to a car mechanic. I go to the car mechanic to get some utility, which is so that my car can go back to normal. I don't know about my car.
Right. I don't know what's wrong with it.
I don't know what's wrong with it. Exactly. So I need the mechanic to tell me what's wrong with my car so that I can then purchase the services that he or she's going to render in fixing the car and getting me back to normal, right? I think healthcare is very similar to that. But the issue here is that it's not free to get an assessment on what part of the services side I should purchase that would help me get better. And it's a whole slew of things that you could do to get better. I could rest at home and do nothing. That in and of itself is a pathway to getting better. I could go to CVS and buy something over the counter, and I could take that and I could get better. I could go to physical therapy. I could go to my doctor.
Yeah.
I could get surgery. I could get an MRI. There are so many services that I could consume that could help me get better. But I, as a person who's not medically trained, don't know which of these I should be consuming. And so the fact that you now have to go to a doctor or an emergency room or to a specialist or to whoever to figure out what part of the supply side I should be purchasing is what is really missing from marketplaces in healthcare. So again, going back to this idea that the first thing we built was a symptom checker, we felt like if you could scale the ability to solve the clinical gap for an individual, if you could empower someone to have a really good understanding that, I should go in this direction.
Yeah.
This one, right? Before they then go purchase the service, can we give them that free assessment, that free empowerment before you then go have to fork over some money in order to figure out what you should be buying? So the evolution to a marketplace was really intentional. So, all right, first we needed to understand the clinical piece. That is what's missing in the marketplace. You solved that. Now we want to be able to curate all of these different services across the entire spectrum of services. Some of them are new age and virtual. Some of them are as classic as some good old, R&R and some ibuprofen. And then help someone figure out, yeah, for what's going on with me, that's the thing I should be purchasing in order to get better. And so the next stage for us, now that we have the clinical component, now that we are baking in the insurance component, which is another piece of the pie, right? The next step for us is to make the transaction, like the consumption of that care, really seamless. So really helping you get the medication that you're looking for, get the telemedicine consult that you need, get the over-the-counter that you're looking for, get the follow-up over the next 10 days as you're resting at home to make sure that you're doing okay. And making that transaction just really, really seamless. And the example I always give is, there's light marketplaces and there's more managed marketplaces. So like Zillow, as an example of a light marketplace, I'm looking to buy a home. I go on Zillow all the time. It hands me off to a real estate agent.
Yep.
And I go do my bidding with the real estate agent. So it's relatively light, right? Like I don't do a lot on Zillow except for research homes.
Mm-hmm.
I would say that's, where we are today as a marketplace. We're handing off to services and products based on your insurance design, based on what's clinically going on with you. The future for us is to move from that world to being more like a Redfin, where on Redfin, right, you have the real estate agent on the platform. You can just directly buy a home on Redfin.
Okay.
That type of more managed marketplace is where we're headed in terms of helping you with the payment, the transaction, the billing, all of the extra uncertainty that happens in healthcare that can make your experience just way smoother, way better. So going to Uber, just because you brought it up, if you don't mind if I use the example, right? Uber is so simple, but we don't think about the alternative. An alternative to Uber would have been, I go into Uber, I look for a ride, and they pass me off they give me a phone number for a taxi cab company. And then I have to call the cab company, and then I have to negotiate a rate with the cab company to say like, hey, I'm going to the airport. How much would you charge me to pick me up and go, right? What does Uber do? They go further, right? They do the supply demand matching and they do the auction of the price.
Right.
And then you go. That is like much deeper of an experience and is so much easier for you as a person than like what I described before.
Absolutely.
That's where we're headed.
So let me ask you a quick question about the Redfin thing in particular. So do you guys end up then building your own care network, or do you continue to partner with companies that are already doing that like you are doing right now?
It's a combination of both things because it kind of depends, right? So if we're partnered with the insurance company or with the employer, we're really working within their walled garden of their network to say, all right, how do I make that handoff like really seamless, really easy? How do I help them deeply understand what they're going to have to pay? Can we actually do more of that transaction ahead of time? If they're doing a cash pay option, then it's a little bit simpler in many ways, because then can we collect the cash up front? Can we, really make the transaction happen in a really, really seamless way? A lot of those tools and services are applicable in both directions. It just depends on whether insurance is involved or not, which is obviously a big complex, but the goal of the company is to make make you getting better just as easy as possible.
I want to ask about the competitive landscape here and hear what your thoughts are on that. So, I mean, like, and after hearing all this talk about the marketplace and moving into that direction, I mean, I feel like it's actually broad in the competitive landscape. But the first ones that come to mind for me are the two most well-funded, Babylon Health and K Health. I mean, and the funding on Babylon is insane. I mean, $631 million. Like, how do you compete? Are you trying to compete? Do you even see those companies as competitive to you at this point? Or how do you see yourself fitting into this space?
Yeah, I really respect what Babylon and Kay are doing. I think investors and those savvy in the health tech space will look at us aesthetically and say, oh, there's like a chatbot component to it.
Yeah, check the bot. Yep.
They got to be competitive. I think that the scope of what we're doing versus what they're doing is just very different in that for both Kay and Babylon, they're going out and providing the doctor as well. They're going out and hiring their own doctors to sit on the service. And really, I see those companies more as competitive with telemedicine.
Okay.
American Well and Teladoc and 98.6, then they are competitive with us in that the point of their chatbot is to make the doctor's life more efficient, their doctor's life, which really is trying to replace kind of the scribe or the nurse practitioner or the PA who is seeing the patient ahead of seeing the doctor on the other side, which is very different than in the Buoy, our product scope, which is to figure out, okay, maybe a primary care doctor is the person you should see, but maybe not. Maybe you should see urgent care, or maybe you should see the emergency room, or maybe you don't need to see anybody at all. Maybe you need over-the-counter medication, right? Or a physical therapist. The set of services from a marketplace perspective is much broader than using a chatbot to be kind of the pre-visit for a physician network that they are contracting with. So
chatbot makes the patient's life easier as opposed to making the doctor's life easier.
Exactly.
Got it.
Exactly. So the point of the chatbot and thus the business models are just very different than one another.
All right. Well, no, we just want to hear it from you. We're just fact checking along the way here, Andrew. We're not going to put words in your mouth, but we want to hear. All right. So tell me what's next for Buoy. You guys, like I said, you closed a C recently. You're well funded. Moving forward, you're not competing with those companies directly. You're doing your own thing now. So what's ahead for you guys? What does the next year look like? And then what beyond that, even tell us kind of what's next. I think you jumped into quite a bit of it with the marketplace idea and talking about, the Redfin versus Zillow analogy. But, I'd like to hear shorter, Tim. What do you have on deck? What's coming up that we can look forward to hearing about?
Sure. In the shorter term, we responded to COVID really early on in the pandemic. We had a COVID specific product in market in early February. There was a few cases in the United States at the time. Worked with two different states, state of Massachusetts, state of Virginia, as their kind of COVID navigation product. UnitedHealth, Cigna, Humana all adopted Buoy as their COVID navigation tool during the pandemic. And then we started thinking about the problem of helping employers reopen, which would be kind of the next phase of the problem. And so we actually released a return to work product in early June, around that time frame. So now we're helping about 100,000 employees kind of come to work on a daily basis. As part of that work, we've now been turning our attention to the vaccine rollout. And so we have a vaccine module that we'll be rolling out to our clients and prospects to help them really manage their employees' kind of understanding of the vaccine, help them understand when they could go get the vaccine, the timing between doses, give them really accurate information that is relevant to their specific concerns, addressing vaccine hesitancy, essentially.
Oh, okay, great.
So we're working with some leading behavioral scientists that are baking in kind of that type of thinking into the product to make sure that, when we're helping the individual employee kind of think about the vaccine, moving them in the direction that is ultimately, hopefully getting them vaccinated while respecting their autonomy, respecting the fact that, there's no mandate from anybody for you to get this vaccine, and really doing almost like from a clinical perspective, almost like a motivational interview, to help people figure out what to do. So that's, a big area of focus for us on the kind of pandemic side.
Sure.
The rest of the year, I think, is really thinking about kind of that evolution of Buoy as a as a marketplace and a navigator, which are intricately tied, those two concepts, navigator and a marketplace, from, as I mentioned before, that lighter weight product to now one that goes further into that healthcare journey.
Awesome. Well, we look forward to hearing what's next for you guys. Like I said, a lot of chatter about Buoy Health over the last year in particular. I think a lot of it did have to do with the early jump that you got on the COVID-19 stuff. So great work there, and it sounds really exciting. I mean, like truly, when we were chatting, in our pre-interview talk, it really. I'm impressed with how your model has evolved, and I think that this has a lot of potential moving forward. And look forward to seeing what you guys do.
Thanks, Jessica. It was so great to be on your show, and I appreciate you having us.
Likewise. Thank you so much, Andrew. For more with the who's who of health tech, be sure to check out my YouTube channel over there at youtube.com/WTF Health. I'm Jessica DeMassa. Thank you so much for joining me and Andrew Lay from Buoy Health. We'll see you guys soon. Take care.